Most people hear oral BPC-157 and think it works like a normal supplement, like magnesium or vitamin D, but that is the first thing to correct. BPC-157 is not a vitamin, not a mineral, and not something you are deficient in the way you can be low in iron. It is a synthetic peptide, and the human evidence is still very early. In this video, you are going to learn what oral BPC-157 actually is, why people are talking about it for gut lining, joint comfort, recovery, and tissue repair, where the evidence is promising, where it is weak, and what safety issues you need to take seriously. And one change you can make today is this. Before chasing a peptide, spend 1 week tracking your sleep, protein intake, digestion, pain triggers, and medications like NSAIDs, because those basic factors often explain more about recovery than any capsule does. And please talk with a qualified clinician before changing supplements, peptides, prescriptions, or anything related to a health condition. So what is oral BPC-157? BPC stands for Body Protection Compound. The 157 refers to a chain of 15 amino acids. Amino acids are the building blocks of proteins. A peptide is basically a small protein-like chain, like a short message your body may use to signal certain processes. A simple way to picture BPC-157 is like a repair memo, not a construction crew. It does not magically rebuild a tendon, seal a gut, or erase inflammation by itself. The idea is that it may influence signals involved in repair, blood vessel activity, inflammation balance, and tissue protection. But your body still needs the actual building materials: protein, calories, micronutrients, sleep, circulation, and time. BPC-157 is often described as being related to compounds found in gastric juice, which is the fluid in your stomach, but the products sold online are synthetic. That matters. Something being based on a body compound does not automatically mean a bottle from the internet is safe, pure, legal for every use, or proven to work.
Oral BPC-157 means you swallow it, usually as a capsule, tablet, or liquid. Some products are marketed as stable or enteric-coated. Enteric-coated means the capsule is designed to resist stomach acid and dissolve later in the intestine. That sounds useful, but it does not guarantee the product works or that it contains what the label says. How might it work in your body? The first proposed mechanism is support for the gut barrier. Your gut lining is only one cell layer thick in many places, and it has to do a tricky job. It lets nutrients pass through while keeping irritants, microbes, and toxins out. Animal research suggests BPC-157 may influence the way this lining protects and repairs itself. That is one reason oral forms are often marketed for gut comfort.
The second proposed mechanism is inflammation balance. Inflammation is not automatically bad. It is part of healing. But when inflammation is too high, too long, or in the wrong place, it can interfere with normal function. BPC-157 appears in animal studies to affect inflammatory signaling. The careful wording here is important. Affect does not mean cure, and animal results do not always transfer to humans. The third proposed mechanism is blood flow and tissue signaling. Some research suggests BPC-157 may influence nitric oxide pathways and blood vessel responses. Nitric oxide is a molecule your body uses to help regulate circulation. Good blood flow matters for repair because tissues need oxygen and nutrients. But this is also where some caution comes in, because anything that affects blood vessel growth or repair signaling raises questions for people with cancer history, abnormal growths, clotting problems, or complex cardiovascular disease.
Does your body make BPC-157 naturally? Your stomach does produce protective compounds, and BPC-157 is discussed as a peptide derived from gastric protective proteins. But that does not mean you can measure your BPC level, like a vitamin level, or that low BPC-157 is a recognized deficiency. There is no standard home test or routine lab test that tells you need BPC-157. What affects your natural gut protection and repair is much better understood. Sleep loss, heavy alcohol use, smoking, high stress, low protein intake, very low-calorie dieting, poorly controlled blood sugar, certain infections, and frequent use of medications like ibuprofen or naproxen can all affect the gut lining, inflammation, or tissue recovery in different ways. That does not mean those medications are bad for everyone. It means you should use them thoughtfully and discuss long-term use with your clinician.
Now, let's talk practical sources, because this is where BPC-157 is different from normal nutrients. There are no meaningful food sources of BPC-157. You are not going to get oral BPC-157 from bone broth, collagen powder, steak, eggs, yogurt, or fermented foods. Those foods may support the raw materials for repair, but they are not BPC-157 supplements. For food-based support, start with protein. A practical range for many adults is about 1.2 to 1.6 grams of protein per kilogram of body weight per day, or about 0.5 to 0.7 grams per pound, especially if you are active, older, dieting, or recovering from an injury. Spread that across the day. For many people, that looks like 25 to 40 grams of protein at each meal. For gut-supportive fiber, aim for roughly 25 to 38 grams per day, depending on your body intolerance. You can get there with oats, beans, lentils, berries, chia seeds, vegetables, potatoes with the skin, and whole grains. Increase slowly, because jumping from 10 grams to 35 grams overnight can make bloating worse.
For collagen support, you can use food or supplements, but be realistic. Collagen is not a magic tendon glue. Some people use 10 to 15 grams of collagen or gelatin with vitamin C about 30 to 60 minutes before rehab exercise. The more important part is still the rehab exercise. Tissue adapts to load. Hydration matters too. A simple target is pale yellow urine most of the day, unless your clinician has you on fluid restriction. Add electrolytes if you sweat heavily, train hard, or work in heat. When do supplements make sense versus when is food enough? For most people, food, sleep, physical therapy, and medical diagnosis come first. If your issue is recurring tendon pain, chronic gut symptoms, or slow recovery, you do not want to cover up the clue. You want to know what is driving it. Is it training load, low energy intake, an autoimmune condition, a medication side effect, poor sleep, an infection, iron deficiency, diabetes, something mechanical?
BPC-157 supplementation usually enters the conversation when someone has already tried the basics and is looking for experimental support. And that word matters, experimental. In many places, BPC-157 is not approved as a medication for human use, and quality can vary widely. Some products are sold as research use only, which is a red flag for consumers. That label often means it is not being sold as a regulated dietary supplement or approved drug. Common oral supplement forms include capsules, tablets, liquids, and sometimes sublingual drops, which means you hold the liquid under your tongue. Oral products are often marketed in microgram ranges, commonly around 200 to 500 micrograms per day, but there is no universally accepted evidence-based dose for general health because human trials are limited. Some clinical research has used milligram-level oral doses for short periods, but that does not automatically translate into a safe consumer protocol.
Timing advice online often says to take it on an empty stomach. The theory is that this may reduce competition with food and digestion, but again, this is not firmly proven. Absorption may be affected by the formula, peptide stability, stomach contents, gut health, and product quality. Alcohol, active gut irritation, vomiting, diarrhea, and certain medications may also affect how predictable oral absorption is. Quality markers matter more than flashy branding. Look for third-party testing from an independent lab, a certificate of analysis for the exact batch, testing for purity and contaminants, clear ingredient amounts, no disease treatment claims, and a company that gives you real contact information. Be cautious with products that promise to heal injuries, reverse disease, or replace medical care. Realistic costs vary a lot, but oral BPC-157 is often priced like a premium supplement, commonly tens to hundreds of dollars per month. A high price does not prove quality. A low price does not prove value. With peptides, the biggest risk is paying for something that is underdosed, contaminated, mislabeled, or inappropriate for your situation.
Who might be interested in this? Not people with a BPC deficiency, because that is not a recognized diagnosis. The people most interested are usually those dealing with persistent gut discomfort, nagging tendon or joint issues, heavy training recovery demands, or general inflammation concerns. But these symptoms are not specific. Bloating can be lactose intolerance, celiac disease, IBS, gallbladder issues, stress, or something else. Tendon pain can be overload, poor programming, low energy intake, hormone changes, or inflammatory disease. A simple self-assessment you can do today is to write down 4 things for 7 days. Your pain or gut symptoms from 1 to 10, your protein intake, your sleep hours, and your biggest triggers. Also note alcohol, NSAID use, intense workouts, and stressful days. Patterns often show up fast. Labs to discuss with your doctor depend on your symptoms, but common options include a complete blood count, comprehensive metabolic panel, fasting glucose or A1C, iron studies including ferritin, vitamin D, B12 if you are vegan or have gut symptoms, thyroid testing when appropriate, C-reactive protein for inflammation context, celiac screening if you have chronic digestive symptoms, and stool testing only when your clinician thinks it fits. Let's make this real.
If you are a budget eater with sore joints and low energy, do not start with an expensive peptide. Start with protein at breakfast. Eggs, Greek yogurt, canned tuna, beans with rice, chicken thighs, tofu, and lentils can get you a long way. Add 2 servings of fruit and 3 servings of vegetables most days. Walk daily, sleep consistently, and track whether pain improves when your recovery basics improve. If you are vegan, your priority is not BPC-157. Your priority is enough total protein, enough leucine-rich foods, and nutrients that commonly run low. Build meals around tofu, tempeh, seitan, lentils, soy milk, pea protein, beans, nuts, seeds, and whole grains. Ask your clinician about B12, iron, vitamin D, iodine, omega-3, and zinc. For tissue recovery, being underfueled is a much bigger issue than missing a trendy peptide. If you have a health condition like inflammatory bowel disease, cancer history, kidney disease, liver disease, clotting disorders, or you are on immune-suppressing medication, do not experiment casually. Your risk calculation is different. You need a clinician who understands your diagnosis, your medications, and your monitoring needs.
Now, the evidence reality check. For BPC-157, the strongest evidence is preclinical, meaning cell and animal studies. In animals, researchers have explored gut injury, tendon and ligament models, wound healing, nerve injury, and medication-related tissue stress. That is interesting. It is not the same as showing clear benefits in thousands of people. Human evidence is limited. There has been small early-stage research, including safety and pharmacokinetic work in healthy volunteers and small pilot-style studies in specific conditions. Pharmacokinetic means how the body absorbs, distributes, and clears a substance. These studies are useful, but they are not enough to prove broad benefits, ideal dose, long-term safety, or who should avoid it. So in plain language, the evidence is early, promising in animals, limited in humans, not strong enough to treat it like a proven therapy. What do we still not know?
We do not know the best oral dose for different goals. We do not know the long-term safety of repeated cycles. We do not know how it behaves in people with cancer risk, autoimmune disease, pregnancy, liver or kidney impairment, or complex medication lists. We do not know whether many online products contain what they claim. And we do not know whether oral BPC-157 meaningfully helps injuries outside the gut in most people. Safety comes next. The more likely side effects reported anecdotally include nausea, changes in appetite, headache, dizziness, fatigue, sleep changes, and digestive discomfort. Some people report feeling unusually energized or restless. Others feel nothing. Less common but more concerning issues include allergic reactions, worsening symptoms, unusual swelling, chest pain, shortness of breath, severe abdominal pain, black stools, blood in stool, persistent vomiting, severe headache, or neurological symptoms like weakness, confusion, or vision changes. Those are stop and seek help signs.
Medication interactions are not fully mapped. That is the problem. Be extra cautious if you take blood thinners, immune-suppressing drugs, cancer therapies, steroids, medications for blood pressure, diabetes medications, or frequent NSAIDs.
Also be cautious before surgery or dental procedures, because anything that might affect inflammation, blood flow, or healing signals should be disclosed to your care team. Special populations should be more conservative. If you are pregnant, trying to conceive, or breastfeeding, avoid experimenting unless your qualified clinician specifically advises otherwise. If you are elderly, have multiple conditions, or take several medications, the unknowns matter more. If you are a competitive athlete, BPC-157 is prohibited in sport, so do not assume oral supplement means allowed. Now, a quick myth-busting round. Myth 1. BPC-157 is natural, so it is automatically safe. No, natural sounding does not mean tested, regulated, or risk-free. Myth 2. Oral BPC-157 heals injuries without rehab. No, tissue needs load, nutrients, blood flow, and time. A capsule cannot replace the right plan. Myth 3. If influencers use it, the science must be settled. No, popularity is not proof. Testimonials are not controlled trials.
Here is the bottom line. Oral BPC-157 is a synthetic peptide with interesting early research, especially around gut protection and tissue repair signaling. But it is not a normal nutrient. There is no recognized deficiency, and the human evidence is still limited. Food does not provide BPC-157, but protein, fiber, sleep, training load, hydration, and medical evaluation are still the foundation for recovery and gut function. If you are considering it, involve a qualified clinician. Check product quality carefully and be honest about your medications, conditions, and goals. Your action step today is simple. Track your symptoms, sleep, protein, and triggers for the next 7 days before adding anything new. That one habit can tell you whether your body needs a peptide conversation, a nutrition upgrade, a rehab change, or a doctor visit. And I'm curious, have you tried oral BPC-157, or are you just researching it before making a decision? Share your experiences in the comments and let us know what supplement you would like to learn about next.